Go.
Okay, Miss Rogers, so today on your medical history, I did see that you do have a family history of diabetes, hypertension, and oral cancer.
Mhm.
Are you currently being seen by a primary care physician?
No.
Okay, well, I would definitely encourage you to find one that you like because, as your blood pressure was 138 over 89 today, that is a little high. And since you do have a family history of hypertension, like we talked about, I would encourage you to find a primary care physician, just to keep that monitored.
Right.
Okay.
Okay.
As well as the lesion that I noted on your tongue. You also have a family history of oral cancer, so that's just something that we definitely want to get looked at. So I'm going to refer you to our oral health clinic over at the main UAMS campus just to get that lesion looked at, okay? All right, so as far as your home care, how many times a day are you brushing?
Once, but really when I can remember.
Okay, so are you using a manual toothbrush or a power?
A manual.
Manual? Okay. Well, we definitely want to encourage you to brush at least twice a day. And we really would like for you to brush right before bed because you don't want to leave all of that food from, your entire day just sitting on your teeth because that's what leads to that overgrowth of bacteria that can lead to diseases such as gingivitis or periodontitis.
Okay.
Okay, so if you'll just take your toothbrush and just show me how you're brushing. Okay, well, just go ahead and pick that mirror up for me and I'm just going to show you. So we definitely recommend that whenever you're brushing, you kind of angle that toothbrush up about a 45-degree angle towards the gum line. Just to make sure, because that right under the gums is where that bacteria likes to hide. So if you just do that, and then of course when you're on the bottom, angle it down. And then on the backs of the teeth, just vertical. But just really, aim towards that gum line to catch all that bacteria. What about your tongue? Do you brush your tongue?
No.
Okay, well just stick your tongue out for me and see, this is where a lot of bacteria likes to hide. So whenever you're done brushing your teeth, I would encourage you to kind of brush down, pick it up, rinse, down, pick it up and rinse, because you don't want to just brush around and around, because for one, that could damage your papilla on your tongue and your taste buds, but then you're also just brushing that bacteria around, okay?
Okay.
All right, what about floss?
Never.
You never floss?
Never.
Okay, well, we're encouraging you to brush. However, whenever you're brushing, that doesn't get down in between your teeth. So what we would want you to do is use some string floss and go ahead and look in that mirror for me. If you'll just kind of get that floss down there in between your teeth, and then you'll make a C around each tooth just to get that bacteria out of those pockets and from in between your teeth. So if you'll just practice that for me, and I'll hold the mirror for you. Perfect. All right, and are you using any mouth rinse?
Yes, but I mix it with water because it really burns.
Okay, well, if you are having some burning, I do see from your history that you're using a alcohol-containing mouth rinse. Since it's burning, I would recommend that you switch to an alcohol-free mouth rinse because that alcohol is what's leading to that burning. So, and definitely, I wouldn't use it throughout the day. I would just use it, once after you brush in the morning and then at night.
Okay.
Okay, and also I did note that you said that you were having some sensitivity to hot and cold. What type of toothpaste are you using?
Something for whitening.
Okay, well, I'm gonna send you home with a sample of our Sensodyne. It's specifically for people who have sensitivities. I'm gonna send you home with a sample of that to see if that helps anything. Do you have any questions?
I don't think so.
Okay.